Hey, I'm Tim Terry. I'm a physical therapist over at Denver Health. Just enjoying the view from our outpatient medical center over in Pavilion L. And we're going to go over a few suggestions to help your postoperative recovery go smooth. Getting dressed postoperatively can be very challenging and frustrating. There's a few ways to make it easier. So first, you're just going to be in a sitting position. You're going to lean forward to allow your operative arm to hang down. And then you're going to dress your operative side first. So Matt's operative arm is his right shoulder. So he's going to pull his jacket up over that shoulder. Go. And then he's going to get into a sitting position and reach behind and dress his other side. And this can take time, and it's going to take practice to get used to. So don't get too frustrated because it is a process. It's a learning process. Keep your sling close by so that you can access it really easy as soon as you're dressed. Some things that make getting dressed easier is wear loose-fitting clothing, clothing that buttons in the front. Elastic pants are a lot easier to pull up. And for women, wearing bras with a front clasp makes your recovery much easier. Something that we run into pretty often is inappropriately fit slings. And when a sling is not fit appropriately, it can increase pain, increase healing times as well, so delay healing. So I'm going to show Matt here how to wear his sling appropriately. So first thing we're going to do, Matt, is I'm going to move this pillow, and you want the curve of the pillow to be adjusted right there against your torso. We can put this strap right over the top so that this is snug in there. The strap that goes behind you will attach to that pillow, and that's going to support your shoulder and those tissues that are healing. The other thing is bring your arm back so that your elbow is sitting in the crease of the sling, and your thumb will be supported by this device. And the neck strap should feel tight, but not straining your neck. So it shouldn't be pulling on your neck too much, and your arm should feel securely supported, and that offloads the tissues that are healing. Having trouble sleeping after surgery is a very normal thing. You'll be sleeping in your sling, which a lot of people find uncomfortable. And so the most comfortable position for people is typically in an inclined position between 30 and 45 degrees. So our table has the capability to do that. So we have Matt here resting in this position, and it's probably the most comfortable for him. If your bed or table does not do that, you can use a wedge pillow, which will allow you to rest at that incline. These can be purchased online or at a store near you. You can also stack pillows to create that same incline. So, and if you're having trouble or you're finding yourself rolling a lot and moving a lot, you can take a pillow and wedge it between your torso and the bed, right by where your shoulder is, and that will support your shoulder as well. So, and you would do that on your operative shoulder as well. So there are some motions that are extremely safe to do immediately after surgery, and they can actually help reduce your pain, help you feel better, and can be done throughout the day easily with your sling on. So one of the first exercises that you can do is just squeezing your shoulder blades back. So when you're doing that, you're just thinking about taking your shoulder blades and pinching them together. So Matt, go ahead and just retract your shoulder blades and then come back. And this is a repetitive motion where you're just slow and controlled, but it's allowing those tissues to move and not be so achy. Another exercise that you can do is just taking your ear directly towards your opposite shoulder. So Matt, if you can side bend left. And this is something you can hold for 45 to 60 seconds, and it's going to allow those tissues that get very tight while you're in a sling to relax a little bit. Another variation of this stretch would be rotating your head to the left, and it's almost like you're looking down towards your armpits. And this stretches a muscle a little bit deeper into your shoulder and back. That is another one that kind of guards and tries to protect you, but really needs to be offloaded to help you feel comfortable. During your recovery, you may experience some symptoms that cause you a little bit of concern, and we have a plan for that. So if you have a sudden increase in pain, you see a spike in your temperature over 100 degrees, some increased bruising, concerns over the fit of your sling, or even more specifically towards your shoulder, if you're having a lot of drainage or streaking redness from your incision site. These are all reasons to call the number that's on your screen. And when you call that number, you'll be able to talk with a nurse, and they will be able to go through your symptoms with you, go through your concerns with you, and help you decide whether this is something that needs to be relayed to your orthopedic team or it's something where you need to be seen urgently.